I feel that AI should focus on healthcare and then get into other industries or other problems that it can solve, maybe with a total bias. So how AI is actually helping? Take the example of accessibility or adoption. How you think that it is helping?
If you ask me, where should AI start helping? I would second your thought and say, of course, it should be healthcare first. So we should solve the biggest problems first, then move into other problems.
Yeah.
Right? So now if you look at healthcare is a necessity, while many other things are convenience.
Yeah.
So we should solve the necessity problem first, then look into other convenience problem. But unfortunately, because of access to many other resources, your interest, funds, etc., there is a lot of work happening in the convenience space. Minimal work may be happening in the necessity space. We should focus a lot more on bringing AI kind of technologies in healthcare. So now getting into the fundamentals of how will AI help and what is AI doing. So first of all, let's just look at the basics of AI itself. Why AI is important. So when you speak to many in our community as doctors, right? So all of us for many years have been averse to technologies. Right? The moment AI came up, all of us said AI will take away our jobs. So especially people like me who are radiologists. Right?
Radiologist.
The penetration of AI in radiology is the highest. So will it take away jobs? That's one part of the trouble. Then second is AI can never match human intelligence, compassion, care, etc. And all the way AI is being looked at by the healthcare community as a villain. But if you really ask me, should AI be looked at as a villain? I would say no, AI should not be looked at as a villain. Rather, AI is something which should be looked as a friend. Now, just to give an example, if you look at, again, doctor being doctor, so if I ask anybody to identify two individuals who are identical in the world, will you be able to identify?
No.
Even the identical twins are not identical.
Yeah.
Right? So if you go from their appearance and till their genetic structures, both of them are different. Will one disease behave the same way in two individuals? It never happens. There will be certain differences. But most of our treatment patterns is based on standard guidelines across. Is it applicable?
Yeah.
Yes, when you look at a population level, with little bit of variations, it's applicable. But with the growth of technology and with the growth of research, now it's time we customize our approach in healthcare delivery to individuals. So that's where AI kind of technology will really be helpful. That's where a lot of growth in AI is happening in cancer and those kind of care. Right? So it will help us understand our patients better. It will help us understand our care better. So with the help of AI as a friend, we will be able to understand our patients and deliver much better care as compared to what we have been delivering, only focusing upon our knowledge.
Okay.
AI will give us an advantage of the knowledge from the overall knowledge bank which is collected worldwide. So we should look at it from that perspective and adopt AI.
Yeah.
So that will help us enhance overall healthcare delivery and outcomes.
But we definitely see that in last 1 or 2 years, quite a many startups are popping up for AI related solutions. It might be like I might be wrong, but everything started after COVID. COVID was a shocker for everyone. Like I personally, whenever I give my explanation on Health Commune, I say that why I'm focusing on primary awareness regarding diseases. That for me as a doctor, it was not acceptable that in 2019 I'm teaching people how to wash their hands. Yeah. And I have to tell people to wash their hands or cover their face if they are coughing and things, where we have worked for years on national programs and other things, and we call ourselves in 21st century evolved species working with technology and other things, and I have to teach as simple as that. I mean doctors community. Okay, so for me, so that's why whenever we work on Health Commune, we focus on absolutely primary health awareness. We speak as basic as what's the definition of the disease, who's a gastroenterologist and who's a gastroenterosurgeon, even as basic as that. I do not think that I'm solving a big problem. I'm trying to solve a very, very basic problem. And I feel COVID changed many things in us. Do you think that during COVID time, many of the AI intervention happened, or many of the startups or initiatives by government that helped us to actually solve the COVID problem and later gave us the door to probably what all things can be possible now and what all other problems that we can solve?
So I would say yes and a no. Right? So if you ask me, did AI revolution happen during COVID? Maybe not. AI has been in the space for really long time. And there is a lot of work which was happening even before COVID. Yes, because COVID rather acted as a jump board for many of these things. While many startups and initiatives were focusing on non-healthcare kind of solutions, COVID got a lot of these people together to work towards healthcare delivery. So that's where we started seeing many more startups focused on healthcare. During COVID, there was universal focus to solve one problem, which led a significant shift towards main focus on public health kind of perspective. That's why we saw many startups. So to give a small example of one of the startups which initiated during COVID and rather became operational within a short period of time was X-Ray Setu, which was developed in IISc by a group of engineers and researchers working along with doctors and radiologists. So if you remember during COVID, one of the biggest challenges in the early days of COVID at least is if you give a sample for testing, it used to take at least a week before you get reports because we did not have many RT-PCR testing labs in India.
True.
There were very few. There were, I think if my number goes right, some 5 or 7 labs across India, and you need to collect sample and send it there. So the other way of how you could diagnose COVID was using an X-ray. So if you do an X-ray, you could diagnose. But the challenge with X-ray is exposure to the outer world increases. The patient has to come out and spread challenges. Right? So now, if you send for a RT-PCR and wait really for 7 days, you really do not know if you have quarantined the patient or not quarantined the patient, you're contributing to the spread. So they were looking at early intervention so that I can diagnose faster. And also keeping in mind the accessibility of the solution to everybody and taking opinion from a lot of other physicians also. That's where this application was developed. It's a very simple application where X-ray is taken, a digital X-ray. The image of the X-ray is uploaded. It works on WhatsApp. If I take an X-ray, I have cough, I can upload that on WhatsApp and ask the chatbot, can you diagnose? If it is COVID, it will tell it is COVID and I can take an opinion from the physician kind of thing.
Okay.
So this worked on a simple machine learning kind of a model which will go analyze a lot of images. X-Ray Setu was built on an image data set from NHS and other data sources where it could analyze and give me an output saying it is COVID. This is the probability. This might be COVID. You need to consult a physician.
Okay.
Which solved a real problem, and the application was developed and delivered within a period of a week to 10 days. So these kind of solutions started coming up a lot. So that's what COVID got us into. But did it stop there? No. After X-Ray Setu, the same team now has moved on to develop multiple other healthcare solutions. So what I'm intending to say here is what happened during COVID is there was an engineering group which may not have worked upon healthcare solutions, pivoted into developing healthcare solutions, but they did not stop there. They moved on to develop many more healthcare solutions.
Got it.
That's how COVID helped.
So we know that during COVID, so I'm just closing the discussion on X-Ray Setu. It's solving a good problem. In tier 3 or 4 or smaller villages, we cannot have access to the radiologist or somebody who can give me the immediate diagnosis of any image. So there is one company that we have done, not podcast, we have done promotional work for them. It's Tricog, if you know, right? So there they have ECG thing in the similar way, which is one of the very beautiful solution, I feel, tele-ECG solution that they have created. Beautiful work. So similarly, now if X-Ray Setu, we are not into COVID setup, but are we still using that for?
Yeah, X-Ray Setu in itself is not functional now at this point of time. There are multiple other solutions which have come out now. So radiology is one of the areas where AI is extensively used. Now there are AI models which can give you up to 95%, 99% accuracy the diagnosis of an X-ray or a CT scan, which is many a times much better than a radiologist himself looking at the image. So that has already happened. ECG, like you rightly mentioned, there are multimodal GPTs itself available online freely, where you can upload your ECG and it will give you a diagnosis today.
Correct.
That is how the technology is expanded today.
Yes, I remember when we were in our rural service, we used to, that was before the WhatsApp time, before the internet time, we used to send one person with the ECG to the intensivist who used to check, or radiologist was not there, only intensivist was there.
Correct.
So they used to, anesthesiologist basically, he used to check the ECG and then say that do this, do that. And I remember one person just running around, every time. But now at least 10 minutes delivery was still there at that point of time. Apart from X-Ray Setu, what are the other things that were there and now they are continuing and doing a bigger work, like any other initiatives that you can mention?
So if you, moving from COVID into other initiatives, while X-Ray Setu was one of those kind of initiatives, very similar image-based analysis initiative, what we are continuing to do at ARTPARK itself, working along with large institutions like AIMS and other kinds, is we call it as a medical imaging data sets for India. It's MIDAS. What we are trying to develop is gold standard data sets. Why are we doing it? It's a very important problem to solve. Because if you look at startups today in India, you might have heard about a lot of startups who have come up and who are using mobile application. Today, accessibility to mobile is there to the last person. So considering that, a solution where you take image of a wound, image of skin, it will tell you if it's a particular condition or not, is a very common thing. There are multiple applications available. But what is the level of accuracy of this? What is the data which has gone behind these applications is a black box still for a lot of people. As a matter of fact, today most of these applications are developed using data from international sources because availability of Indian data which can be used for development of such kind of solutions is very limited. So because of that, there is a lot of international data which is being used. What happens with that is there is a lot of bias. So we are only what we have learned, and AI is the same. Right? So it only learns on data what is fed into that. If I feed only data from international sources, if it has only Caucasian images, if I use the same Caucasian source to detect something on an Asian origin or an Indian origin, it may not be perfect 100%, right? So the accuracy levels will fall significantly on the ground. So this is one problem what we are trying to solve. Similar to what X-Ray Setu was doing while we are taking X-ray images. Here we are taking multiple kind of data sources. And also what we are trying to do is define what do you mean by a gold standard data set. If I am a startup today, I want to develop an application which will help me taking an image, diagnose oral cancer, diagnose a dental carie, simple things, right? So what is the kind of data I need to access? So if I am using image of the mouth, what all should be there in the image? What should be the resolution? How it should be stored? What are the metadata which should be included? Metadata means which area have I clicked image of? What am I seeing in the image? Is there redness in the image? Is there a wound in the image? Is there an ulcer in the image? All these things have to be defined. So these are kind of specific metrics what we are working out with ICMR and AIMS kind of organizations to see if we can define these standards so that it becomes easier both for doctors and startups to build better applications. One similar application is something what we recently started testing out in the market for diagnosis of, not diagnosis rather, for screening of oral cancer. So oral cancer is a very big problem in India. And it is a India specific problem. So oral cancer is not a big problem outside of India because we have a problem of tobacco chewing, smoking, etc. Right? So if we can screen oral cancer at a very early stage, we should be able to cure a lot many more of them. So this is what the application really does. So ASHA workers or your field level workers who are there can use such kind of an application to just take photos of the mouth and up to around 80-85% is what we are looking at accuracy right now. It can screen and tell what is the probability percentage of that person having a oral cancer.
Beautiful. Okay.
So this is at a very early stage right now.